Great. As Marcus said, I'm Chris Bischoff. I'm Senior Investment Director at Kinnevik. We're a 80-year-old Swedish investment company with a $9 billion balance sheet. We focus on really trying to find and invest in disruptive companies and use our permanent capital to make a permanent difference. We've been lucky enough to be associated with some great companies over time, and Babylon Health is one of them. I'm accompanied by Ali Parsa, the founder and CEO of that business, and we can spend a little bit of time talking about the business, what it's trying to do, and how the journey has evolved over the 3 years we've been involved. So Ali, I guess the catchline for Babylon Health is making healthcare accessible and affordable to everybody on the planet. How is that possible?
Chris, to make healthcare accessible, you almost, as long as you put most of the healthcare most people need on the devices most of them already have, that makes it highly accessible. You could almost do now with healthcare what Google did with information. The problem is not the accessibility, because a doctor behind a mobile phone costs exactly the same as a doctor at home, right, or in a surgery. The problem is there's no such thing as accessibility without affordability. And when you look at the costs in healthcare, they fundamentally sit in two buckets. It's salaries. 70% of all the money we spend in healthcare goes to doctors, nurses, the professionals, and it's timing. 2/3 of all that money, in turn, goes into treating predictable and preventable diseases. So what we do in Babylon is create the technologies that enable us to, on one hand, minimize the amount of time a doctor needs to spend and force doctors to, if you want, trade at the top of their license, and on the other hand, tries to predict the future of a person's healthcare. So one of the things we just did, we just hired the CTO of McLaren, the car company. Why? Because Formula One is where the world's biggest experiment happens every 2 weeks. Every car that drives generates 1 gigabyte of information per second, and these scientists in McLaren take that information and simulate the future of the car. And now, if an AI is driving a car, it does a better job than if a driver is driving it, because it works on that simulation pattern. But why not do that with a human body? So we just launched a digital twin that allows us to start marking a human body and then eventually simulating it in many different ways to try and predict the disease before it happens.
And this technology, you talk about AI. AI is a much used term. What technologies are you using, and how have you, in a short period of time, been able to build this?
It's a very good question. If my grandmother, who unfortunately passed away, if it was still alive, her cooking, she would now argue that I'm making it with AI, because everybody I see everywhere is now using artificial intelligence on everything. But the reality is, AI is just one of a myriad of technologies that are there. So we are now seeing for the first time the advent of a new architecture of computing. The old computing models, even the supercomputers, can now do, 40 qubits, 50 qubits of processing. We now are having quantum computing that can do as much as 2,000 qubits of computing. We are now going to, we are experimenting with 5G, for instance, in Asia, where the speed is 100 times that of 4G. We are now taking into augmented reality and virtual reality, where we can present information in a fundamentally different way and look at things in a very different way. And by the way, by we, I don't mean Babylon. I'm talking about technology as a whole. We're moving from predictive analytics to prescriptive analytics. So we don't tell you anymore that what is this you can do, but why can you do it, when is it going to happen, how is it going to happen? Imagine what we are doing with weather at the moment, and imagine if you could do that with your body. And that is in technology. But when you take that and look at what is happening in medicine, Chris, it is fundamentally a different world. We are now getting to a world where synthetic biology or electric biology, where we are getting to a world where laser manipulation or audio intervention, whether we are creating organs or creating DNA molecules, nanomolecules, everything is for grab. We now have a mouse that is 10 times more intelligent than an ordinary mouse. We've created worms that can live 6 times longer than an ordinary worm. We've created tomatoes that do not age. Everything we know about healthcare, everything we know about technology is about to be reinvented. Everything that is solid is melting into air. And these old technologies that we associate with digital health, I don't know, somebody on a video, a doctor on a video, this is 5 years ago's story. In 5 years' time, we will see the kind of technology that will reshape healthcare fundamentally. And it's incredibly exciting.
And you say that because it feels very much so that healthcare needs change, right? It already represents double-digit percentage of GDP in most developed markets. Life expectancy is no longer growing in developed markets, and it's woefully low in emerging markets. So it feels like there's a real need here. How concretely is that going to change? How are the risk-bearing entities, the payers in this whole equation, going to move towards adopting solutions like Babylon so that we can get better value from healthcare?
So what we are seeing in some of our markets, we're seeing in Asia and in United States, incredible desire to change. Because in the US, while most of the payment now is pay-per-use, they're now moving to what they call value-based payment. And what we're seeing is that we're having a lot of conversations where people are saying, if we give you a capitated use, because remember, it's very easy to deal with a patient on pay-per-use. You just pay me, I do the deal, I kind of look at the margins. The question is, can you take a capitated risk on patients? So in NHS in Britain today, we take a capitated risk. You have an unlimited access to us for the same price that the GP gets paid for anything else. We don't charge $1 more, and you can see us 24/7 within a few minutes, right? Our thing. We're taking that model now to United States. We're taking it to Asia, and what we're seeing is significant conversations. We'll have some amazing, sizable deals to announce shortly, which tells me that the adoption of technology in healthcare is going to come at a pace for economic reasons that you described before.
Terrific. And we talked about doctors, and you actually said, which the audience may not appreciate, is that Babylon in the UK actually gives access to doctors, the last mile, if you will, in an Amazon analogy, to physical doctors. How important is doctor well-being here? You know, when you read out in the world that we've got the highest levels of doctor depression, the highest levels of doctor burnout, what's going to happen to doctors in this world? And can technology help them?
So it's really interesting. An average doctor in general practitioner in UK, 85% of them express dissatisfaction with their job. 95% of doctors who work for us are very satisfied with their job, they say. We have 10 times more doctors in a queue wanting to join us that we have rooms for, and it doesn't matter how many more we add, that queue seems to get longer and longer. The reality is people will shift. The kind of work they do now, which is in a small shop, if you want, is a corner shop, is a mom and pop shop, where they have to deal with inefficiencies, lack of technology, lack of actually professional services in an organization, and they move on to new models of delivery. But doctors will do a great job for years to come. The world, look, all the healthcare we have, everybody, is for half the world's population. That's who has access to $10 trillion of expenditure. In Rwanda, where we look after a third of the population of Rwanda, you can now access a doctor at the same speed that you could do it in UK with Babylon.
Yes.
So you can equalize, you can democratize healthcare for everyone on earth, and people like those in Rwanda normally had no access to healthcare. They got one of these in their pockets. And we can deliver most of the healthcare they need in their hands, but you can't do it with human doctors alone because the world is short of 5 million healthcare professionals.
And I read that in the NHS, now the expectation is either AI is adopted or we need to employ another 600,000 doctors by 2028. Is that what's going to happen? Do you think the governments are going to wake up and the payers are going to wake up around the world to this fundamental issue that we can't solve it through human capital?
I think they already have. I think there's a lot of dramatic debate around, is AI a good thing, a bad thing? I mean, it's kind of, you know, I mean, can you imagine if you could play chess today and you had to pay money, you gamble for playing chess, and you had the choice to use artificial intelligence alongside you to help you in that game or not? I mean, you'd be immoral, irresponsible to gamble without the use of artificial intelligence if the game allowed it. How moral would it be in a few years' time to diagnose a patient without artificial intelligence? We did an event in the Royal College of Physicians where Stanford University, Yale University tested our artificial intelligence against real doctors. There's a Horizon program about it tomorrow night. I'm sure that or the night after tomorrow, I'm sure as that is BBC, it'll say on one hand this, on the other hand that, but it'll show the test, right? And we outperform doctors both in examination and in practice. So I think, but that is the beginning. We are at day 0. We haven't even begun yet, right? I look at some of the stuff that are happening in our labs today, which is always lags about a year behind the stuff that people can see, is mind-boggling to me what we could do.
And Ali, final question. When we first met each other, you had about a 30-person team in a loft in Notting Hill. Today, I believe you've got over 1,000 people working on 4 continents in the business. I mean, how have you achieved that sort of scale? And what's next?
Look, you will see a lot of entrepreneurs sitting around saying how brilliant they are, how clever their team is, so on and so forth. The truth is that it's a lot of luck involved. And we just got lucky. We got lucky. We now have probably more money in our bank account, as you know, as we ever raised in cash. We are selling a lot of the licenses to our technology. We're selling it to other digital health companies, as well as insurers, so on and so forth. But the next step for us is to take what is an absolutely rudimentary technology and take it now to not just be a primary care artificial intelligent doctor, but be a doctor in every specialty. Not just speak in English, but speak in every language. Not only understand Anglo-Saxon medicine, but understand every kind of medicine. We have now, as you said, 1,000, the largest collection of scientists, engineers, mathematicians, clinical academics in the world, back in London, but also in our offices in Austin, in New York, in Vancouver, in Singapore, all working towards the same end. We will. And if it's not us, it'll be somebody else. Who cares? Humanity doesn't care which company they do it. But it'll be us or somebody else. But we will make, Chris, healthcare accessible, affordable. We will put it in the hands of every human being on earth. We will do with healthcare what Google did with information. This problem will go away.
Thank you, Ali.
Thank you.
Thank you, audience, for listening.